Good evening, everyone, and thank you for joining me for day three of our continuous series dealing with the issues of maternal mortality in the United States. Over the last 3 days, we have been looking at the incidence of maternal mortality, what are the causes for maternal mortality, and walking back just a little bit to understand some of the history that is so important as we begin looking at how to take better control of our healthcare and why that is so important. And so I've been reviewing the history to just let the audience see what has happened when there has been loss of the ability to make decisions for yourself in the healthcare arena, and also to have the history of what has happened to Blacks and other people of color in the United States in the medical system. So, a very quick summary for that is we looked at, let me make this a little larger and everyone can see better. We've looked at slavery as being forced use of medication, where slaves were forced to consume medication even if they did not want to. That the medication was not curative, but oftentimes used for punishment and also for entertainment and humiliation. In 1824, we saw where we were beginning to see reports of graves being robbed of Black bodies that had been recently buried to be able to advance medical research and medical education. In 1932, we talked about the Tuskegee syphilis study that began in 1932, where 400 sharecropper men were exposed to syphilis, and were left untreated for 40 years, even though penicillin was available to them. And the purpose was to be able to see what would be the normal course of what would happen to someone when they had syphilis if we just left it to let syphilis run its course. We saw in 1951, we talked about Henrietta Lack, who had her cells taken when she had a tissue biopsy done for cervical cancer, and her cells did not die. They actually proliferated and just continued to reproduce. They were called immortal cells, and how her cells were shared with labs all over the world. And to this day, the family continues to fight. They have never been paid anything for the use of her tissues. And she is seen as the kind of the incredible, for modern medicine, her cells have caused incredible breakthroughs in all areas of medicine, including vaccines, including in vitro fertilization. So, what we're going to do tonight is talk more about what has happened on the female side of things. Not to when we get into sterilization, I am not going to suggest that men were not victims of this at all. But let's talk a little bit more about what continued to happen in the 1800s, around 1840, once again with slavery. We are just hearing about Anarcha. Anarcha was a 17-year-old girl who was used as her body was used to experiment on surgeries to treat what we know or call it's fistula. And when women have had a lot of babies, keep in mind, as we discussed earlier, that the slave trade ended in terms of bringing slaves to the shores of the United States. But to be able to continue to have the slave workforce, women were seen as breeders on the plantations by their slave owners. When you have a lot of babies, it will thin out the wall of the uterus. Even when you have a baby today, we will check to make sure that there has not been a tear into the rectum or around the uterus at all. And so That is called fistula when there is a tear. You can have a tear that goes into the urethra, which is the tube that carries the urine out from the body, from the bladder. And you can also have a tear into the rectum. And if this tear is not repaired, you will have leaking of urine and leaking of stool. And so once this happens, you're not able to work. And imagine the smell with people around you as well. This is a continuous problem abroad. This is a major problem in countries abroad. So much so that there's actually a fistula hospital in Ethiopia. But Ethiopia is not the only country that deals with fistula. So what happened was there was a physician there who the slave owner allowed him to have Anarcha. And what he did was to do experiments of surgery. Can you imagine having surgery on your female parts? This woman, again, a young girl, actually at 17 years of age, this is in around 1842. He continued to do surgeries, not only with Anarcha, but with Betsy and also Lucy. It is reported that there were approximately 11 women that he experimented with to try to be able to call himself fixing this problem of the fistula. The problem was he continued to do these surgeries, and actually, in my reading, he was considered to be a failure because he wasn't able to get this right. But yet he continued to do surgeries. Anarcha had 30 surgeries on her female parts. 30. And she was held down. She was not giving any anesthesia whatsoever, even though anesthesia was available. Betsy and Lucy also were part of this experiment. We don't know the names of the other women who were included with this. Now, Dr. Sims is seen as being the father of gynecology, but what is now coming and you're hearing more of is what all went on for this advance in gynecology, is the experimentation on women without anesthesia. That makes you want to get upset. I know for me. The other thing that we have is, I'm giving just a little bit of a litany in relationship. Yellow fever, there had a yellow fever outbreak in Philadelphia. And it was assumed or thought that Blacks would not succumb to yellow fever, that they were more immune or whatever. And so it was asked for the Blacks to be able to help care for the whites in Philadelphia with yellow fever. What became of that is, of the 5,000 people who died from yellow fever, 200 to 300 of those persons were Black people who died because they were caring for whites during this epidemic. I want to move to sterilization. And I want you to understand why we have the consent forms that we do today is because what happened with sterilization in the United States of America. In 1907, Indiana was the first state to be able to legalize sterilization for what was called feeble-mindedness. And sterilization is also linked to the whole eugenics movement, where with eugenics, it is the thought that we don't want those that are the weak to be able to continue to, they would say, regenerate or have babies, because this would weaken the race. It was also thought that the Nordic and the white race was the superior race. We still deal with this foolishness today. Anyway, sterilization was first legalized in 1907 in Indiana. And when you see that law, the actual law for what is feeble-mindedness began to have more of a general description. But it could be anything, could be seen as being feeble-minded. In 1927, the Supreme Court, yes, the Supreme Court of the United States of America, approved forced sterilizations, and this assisted in the expansion of forced sterilizations. What also happened was more of a focus on people of color. And this is when you began to see more women being sterilized forcibly. Fannie Lou Hamer, who was quite a famous civil rights activist, spoke up about this because she herself was forcibly sterilized. She went into the hospital to have a surgery, and during that time, she was given a hysterectomy without her knowledge or her consent. Under the early US government Medicaid program, yes, I'm talking the Medicaid program that we know about today. In the early years of the Medicaid program, Blacks, Latinas, Native American women were targeted. And between 1960 and 1970, it's reported that 100,000 Black, Latina, Native American women were sterilized without their consent. So when you look at the consent forms today for someone who is covered under Medicaid, a lot of people are covered under Medicaid these days. If you want to have your tubes tied, which is sterilization, there is a 30-day wait period between the time that you sign the consent form and the actual day that you are able to have the sterilization done. There are some reasons, say if you are pregnant and you had your baby delivered prematurely, that is a possibility to have your tubes tied at that time. But when I worked, we would explain to women about this procedure. We would get their consent, making sure that they understood what they were signing for, and also understanding that just because you sign a consent form does not commit you to having to follow through with that procedure. And so we would be very clear with women that you could be actually in the operating room on the operating table and you can change your mind. So this is where we now have the consent forms that we see for Medicaid for women who choose to have their tubes tied. So as we look at this, an overall summary is that we're talking, slavery. We're still dealing with this. The other thing I want to say is that forced sterilization is still legal in the United States. It's also still legal in a number of countries around the world. And this is why, as we move further into talking about having babies, reproductive health, and all of that, a lot of women make a decision that they may want to have their tubes tied when after their pregnancy has ended, or even if you're not pregnant, you can, of course, have your tubes tied. It's just to know that this is where all of the consent forms that we see today has come from because of the coercive actions, the forced sterilizations that happen. I would like to share a personal story with you. My sister, well, there are 4 children in our family. 2 of us, my brothers, have gone on, but we were born in the 1950s, and the period of when the sterilization really was rampant was in the 50s. And as you can see, 1960, 1970, under the Medicaid program, it ramped up even more. We were born at Johns Hopkins University Hospital. I found it very interesting that my mother, in her late 80s, said to me that she had had her tubes tied. And she was told that if she had had more children, keep in mind, my mother had had three cesarean sections. My sister and I are close in age, 11 months, 3 weeks apart. She was told after that, had she had another child, that it would have put her life in danger. And as I reviewed this information on the history of race and medicine and looked at the context, thinking about Henrietta Lacks, 1951, Johns Hopkins University. We were born in the 1950s at Johns Hopkins University, the forced sterilization that was going on. I had a very, very disturbing thought, and I think this thought is true. I believe that my mother was sterilized without her knowledge and consent and was told about it after the cesarean section for my sister was completed. That makes me very upset, very mad, because the reason I think that this is the case, if my mother had made this decision on her own, I don't think she would be sharing this with me 50 years after this case, after the situation happened. Usually, if something is bothering you or in the back of your mind, it's something that stays with you. And when she told me about it, it was as though she wanted me to know this, and it was something that she was not proud about. And I, as the midwife, had to console my mother. I had to let my mother know that it was okay, that if God had intended for her to have another baby, that she could. Keep in mind, sterilization is not 100% effective. There is still a very small possibility of becoming pregnant after your tubes are tied. But my mother was saying this to me as if to say she needed to say this to somebody. She needed to tell someone. And I was the person because I was the midwife. And I really had to tell my mom it was okay. So, this is some of our history. And I've shared this history as I want to help families to be more engaged, to understand that they can have the birth that they want, that they can take action to make changes, that they don't have to, that you are able to make changes to that consent form, that you should always know and read what's in the consent form, never leaving any blanks, no blank areas that are not filled in before you sign. So I want to thank you again for taking your time. Um, Next time, we're going to talk about some more happier stuff, okay? I think we'll start to be able to move into, you want to have a baby. How can you plan and prepare and be able to have this great birth experience that you'd like to have, where you're healthy, your baby is healthy, the whole family can be healthy? I worked at an incredible place in the early years of my midwife career called Booth Maternity Center in Philadelphia. And Dr. John Franklin, who I will never forget, was the medical officer there, the chief medical officer. And it was required that every family had a birth plan. I still see Dr. Franklin sitting in his office with patients, and his question would be, so, what would you like your birth to be like? That's the question I would like for you to begin asking yourself if you haven't asked yourself. What would you like your birth to be like? And that's where we'll take it the next time. So thank you again. I appreciate your time. look forward to being with you again tomorrow. Have a great night. Thank you.